Hi all, I'm Dr. Kumar Parth. I'm consultant surgical gastroenterologist practicing at Sagar Hospital, Banashankari. We'll discuss about colon cancer today. So colon basically it's a large bowel which is the end part of your digestive tract. Mostly cancer we see in the age group of more than 40 years, but nowadays on and off we keep seeing in the younger age group. The least younger age group which I have seen in my practice is a 13-year-old. So nowadays, any blood in the stool, any alteration of bowel should not be ignored. It should be addressed as soon as possible. So, what are the signs of colon cancer? Generally, first, most common uh, presentation which patient has got blood in the stool. So it can be a very minimal blood, which is the stool is just getting stained by blood. It can be a profuse bleeding, and second most common symptoms where the patient typically says it's a diarrhea kind of thing. Means he is not a healthy person who was never constipated, start having constipation, and he passes motion early morning. When he wake up, he passes 4 or 5 times of motion. The motion may accompany with blood, may not accompany with blood. And typically what happen in the colon cancer, where like when you have a growth in the large bowel, end part of the large bowel or mid part of the large bowel, the stool gets accumulated above the growth, and it keeps sipping slowly because you have only narrow hole to pass the motion, and we termed as a spurious diarrhea. Any old age guy, any more than 40 years guy who was fit, I mean apparently, who start having this kind of constipation and spurious diarrhea, means sipping of stool early morning. When you wake up, you go for 3 4 times motion on and off, maybe with blood, without blood. If he sees, he need to get evaluated. So colon cancer, generally our evaluation starts with a basic we call colonoscopy. What is colonoscopy? It's a video scope. It's a very flexible video scope which we pass through the motion area. We see whole the colon. We define the issue, whether it's any simple ulcer or it's a growth. Depending upon the growth, we can take a biopsy at the same time and prove it's a colon cancer. Nowadays, colon cancer is almost treatable. It's an early stage 1 and 2. When the problem with the cancer, it the cells goes in the liver and it starts a tumor there in the liver tumor. We call metastatic colon cancer. So it's my simple 3 word: any alteration in the bowel habit, any blood in the motion, any recent onset of constipation need to be get evaluated in spite of any age group, starting from whether it's a 10-year-old or it's a 60-year-old. Thank you.